Let's talk about the pharmacology of adenosine. Adenosine is an antiarrhythmic that we give in the emergency department to treat supraventricular tachycardia, or SVT as we call it for short. And if you remember, for the heart to be able to contract and beat, all of those cardiac myocytes have to depolarize. We're trying to change the charge inside the cell, and we do that by shifting potassium, positively charged potassium ions, out of the cell. And when you and I give adenosine, it opens up all of those potassium channels, and a lot of that potassium flows out of the cell, which hyperpolarizes it. So it takes it in the opposite direction of depolarization, which is then going to cause the contraction. And so if we're taking away the myocyte's ability to be able to participate in that contraction, of course, the heart does a little pause and a reset. And as we all know, adenosine has a super short half-life, about 10 seconds. But when you and I are giving that adenosine, which we always give by stopcock so we can push the adenosine and then push a mega flush behind it, because it has such a short half-life of 10 seconds. And when you and I give it, that 10 seconds feels like 10 business days while we're waiting for it to do its thing, reset the heart so that it can go back into a normal sinus rhythm. But it's super important for us to warn our patients ahead of time. If they've never been in SVT before or they've never received adenosine, we got to explain to them, hey, this is going to feel like you got kicked in the chest by a mule. It's not going to feel very good, but it's only going to last a few seconds. But I'm going to be right here with you and we're going to take really good care of you. Let's talk dosing. We almost always used to start with a 6 milligram dose, and if that didn't work, then we would go to 12 milligrams. But there's so much data that tells us that 6 milligrams isn't nearly as effective as 12 milligrams. And actually, there's one study that showed us that the 6 milligram dose actually had worse outcomes than the ones we just went ahead and started with 12 milligrams. And of course, be ready with your plan B in case the heart doesn't restart after you give that adenosine.